Well, I think why don't we go ahead and get started, and other people can jump in as they join. So my name is Andrew Holbein. I'm joined by Steve Mumford and Tasha from the University of New Orleans, and I'll just jump into a little bit of housekeeping before we get started. So there's options for closed captions in the menu in the control panel. For me, it's under the three dots of the more section that you can choose captions. So all of you are muted, though we can give you permission to speak. So if you have a question or something that you'd like to share, you can just start by putting in the chat or QA. Tammy from the ViaLink team is monitoring that, and so she'll flag questions that come up or save some of them perhaps for the Q&A at the end. But if you'd like to, speak, just jump on and onto the chat and say that, and we can unmute you. So this webinar is being recorded, and we'll post it onto ViaLink's website later today. And if you're experiencing internet issues or technical issues, probably the easiest thing will be for you to call in. The webinar ID is listed there, though it should also be listed in the invitation that you guys got when you registered. So here are the three speakers, myself, Steve, and Tasha. I'm with ViaLink. I'm the Director of Resources and Data. After I give some information, some overview, Steve's going to jump in and talk through some of the methodology and findings. And finally, Tasha will jump in and show some really interesting information that she found about gaps in services and some nice mapping that she did around that. So just a quick overview of what we're going to cover in the webinar. I'll start by talking about, just to give context to all of this, what is ViaLink, what is 211, and the data that we collect through that. Talk some about the ways that our data is used. Then Steve will jump in and talk about the methodology that we used for this study and some of the findings, looking at things like the call volume, demographics, the needs that we are seeing amongst callers. And Tasha will take over and talk about gaps in services before we finally talk about conclusions and recommendations and going into a Q&A session. And as I mentioned, Tammy from ViaLink is monitoring the chat and the Q&A, so feel free to just put in your questions and your thoughts as we go along, and she can jump in and flag them. So about ViaLink, we are a nonprofit. We're based in New Orleans, based in Mid-City. We've been providing 211 type services for over 100 years. The organization was founded in the Great Depression and started as a volunteer agency where folks were collecting those in needs with resources. We've evolved with the times now, and our biggest service area is that we manage a crisis contact center that's staffed with about 50 call specialists, very sophisticated group of people. A lot of them have masters in social work or counseling. They're overseen by a team of clinical folks who, ensure high quality services. The contact center manages more than 30 crisis and human service lines. So like the 211 system that we'll talk about here. Also the 988 system that recently launched this summer. There's a new 3-digit dialing code, just like you would dial 911 for emergency services, 211 for human services. You can now dial 988 if you are in a mental health crisis or having suicidal thoughts or experiences. Then you can dial 988. You would be connected with ViaLink for 3 of the area codes of Louisiana. And so, we offer a number of other crisis and human service lines. Some of them are national, some of them are for the state of Louisiana, some of them are very local, like we provide the Prison Rape Elimination Act hotline for Orleans Parish Prison. So if a prisoner in Orleans Parish Prison was sexually assaulted, they would call the PREA number that is posted throughout the facility and get connected with one of our staff who would provide support and help to initiate an investigation into that. And so we work with tens of thousands of people a year, which is what allows us to collect the rich data that this study is going to, has been looking at and that we'll be talking through today. ViaLink has dual accreditations by AIRS, the Alliance of Information Referral Services, that covers our INR work, our work connecting people to services, and then the American Association of Suicidology accredits our crisis work. So what is 211? That's where the system that all this data that we've analyzed through this study is coming from. So 211, and if you're anywhere in the country and you need human services, you need to connect with a food pantry, you need to find mental health services, substance use services, you can just dial 211 or you can text 898-211. You can do it 24/7 and you'll be connected with an organization like ViaLink, and the staff there can provide emotional and crisis support and connect people to services. ViaLink manages the state's largest database of health and human services. So we have more than 3,000 organizations in our database. I see that Deanna Allen, who's our lead resource specialist, is on the webinar today. Deanna leads a team of 4 staff who focus exclusively on maintaining this really rich, extensive database of service organizations that then our team connect people with. And so we were in this study analyzing not only the data that's collected from the 211 callers, but also that database to sort of see, what services are available, where there are gaps. And so Tasha's going to get more into that and how we mapped the services and sort of identified areas that didn't have organizations providing resources to people in their area. So the Louisiana 211 network, ViaLink is one call center. There's another organization that manages a call center in Lafayette, and the third that manages a call center up in Monroe. And together we make up the Louisiana 211 network. We were contracted with the state of Louisiana. I see that we have staff from DCFS on the call, and we're contracted with them to act as the state's source of information and assistance during hurricanes and pandemics, so like COVID or Hurricane Ida. We collect a lot of rich, useful information then. So this is the 10 parish area where we provide 211 services for. You can see that it's really the eastern part of the boot of Louisiana, southeast Louisiana. So it's those 10 parishes that are in dark blue. So how's this information useful? Just a quick look before we dive into some of the findings of this study. So 211 data is really unique. It's really the best source of real-time information about what the needs of people are. So as I said, we have tens of thousands of people calling us every year, and we're collecting things like demographic information about what their needs are, information about their location are. So that just creates this really rich data set that doesn't really have a parallel. And we publish all of our data through dashboards on our website. I think Steve is going to drop in the chat link to those dashboards. So those are rich interactive dashboards that show the entire span of data that we've collected for the last 10 years. And it's broken up into specific dashboards like the dashboard that we put out after Hurricane Ida to track data from that, dashboards about what the needs of people are, the dashboards about demographics. We're about to launch some cool dashboards looking at what our data shows about social determinants of health. So it's a rich data set, that you can look at broadly and look at trends over multiple years, or you can look at really narrowly, like I said, after Hurricane Ida, of what were people calling from, what were their needs. And so this data is used by a range of organizations. Originally, we launched the dashboards because local foundations were funding it because they were interested in understanding what the needs of people are as they make funding decisions. But then you also have nonprofits like Second Harvest. We've partnered with them to analyze our data to look at where we were getting calls from people who needed food pantries but didn't have food pantries around them. So I was informing Second Harvest of where they should be looking to open new food pantries. The city of New Orleans was telling us that they were using our data during COVID to see where people were calling in, looking for testing facilities or looking for vaccine locations to help inform their mobile testing and vaccine sites. So some things to think about as we're moving through this webinar is how you all might use this kind of data, what other type of analysis would be useful for your type of information. Are there ways that you could partner with ViaLink or connect folks, your clients, with 211? And feel free to drop ideas in the chat or save them for the Q&A, and we can talk through that. So now I'm going to hand this over to Steve Mumford from the University of New Orleans, and he's going to partner. I'll say that, you know, we reached out to Steve and his team because we have this rich amount of data, and we have people with data skills on our team, but, you know, we didn't have the sort of level and depth of knowledge that Steve's team did at the University of New Orleans. So I know that there's some other 211 folks nationally on this call, and I think that, you know, that's something that we found very useful, was to partner with Steve to sort of do this deep dive into the data that he was able to do. So Steve, I'll hand it over to you.
Yeah, thanks, Andrew, and great to see so many folks joining us today. Thank you for being here and expressing interest in this research and in this opportunity and service. I just dropped our report, a link to the final study report in the chat. We're going to go through some of the highlights of the methods, the design, and the findings from that report. But of course, as Andrew said before, please, any questions, any insights or ahas, feel free to drop them in the chat, put questions in the Q&A. Some of them we will address as we go. Some of them will have hopefully plenty of time for Q&A at the end. And so we really want to hear from you throughout this webinar. So again, I'm Steve Mumford. I am an assistant professor of political science at the University of New Orleans. My main focus is on the Master of Public Administration program, and part of our MPA is that we, I see a need for the link again, let me redrop that. So the MPA program, the Master of Public Administration program, has a focus on nonprofit leadership. It also has a capstone requirement. And so my colleague, who will be talking a little bit later, Tasha Shanavla, is a candidate. She'll be graduating this fall from the MPA program, and she focused her capstone research on this project, and she did some amazing mapping. She's getting a certificate in GIS mapping, so she'll talk about some of the insights she was able to derive from mapping the resource data and comparing that to the greatest needs. So what we did here was we took 10 years worth of call reports. So every time somebody either calls or texts or initiates an online chat with 211 with ViaLink, that generates a call report. It is confidential. It only the only identifying information from that report pertains to the person's phone number. When ViaLink partnered with us, they only shared anonymized data, so we had no access to phone number. It was completely confidential. And we looked at 10 years worth of call report data that ViaLink had collected and compiled. And so that spans from the beginning of 2012 to the end of 2021. And we've been working on this for about 9 months now, since we received the data and started the analysis. And we look for lots of different trends in terms of the volume and trends over time, demographics of callers, where they're calling from within the 10 parish service region, and their greatest needs, and the extent to which those needs were able to be met by existing resources. As Andrew mentioned, ViaLink also has an extensive database of resource organizations, nonprofits, public sector agencies within the region and beyond. We also analyzed that resource network. It's constantly growing and evolving, but as of last February, and we're able to then map those locations and compare them against inferred needs and vulnerability of populations based on census data. And so the Census Bureau obviously collects a wide variety of information, and the CDC has compiled that into a social vulnerability index that is looks at 15 variables across 4 categories: socioeconomic status, household composition, race, ethnicity, and language, and housing and transportation. So we were able to compare that against where resources are located, and specifically in terms of anticipating where the greatest needs would be post-disaster, such as a hurricane that is all too common in our region. And we did limit our analysis to only 211 calls, even though ViaLink does so many other services, as well as only our 10 parish service region. So calls had to be initiated within Southeast Louisiana And so this does not include other call lines that ViaLink administers. It also does not include people who called an automated resource hotline, particularly post-disaster, to get support with that. So it's a subsection of the total call volume that ViaLink receives. So if we could go to the next slide. So I'm gonna talk about the results in 3 areas. First, we're going to look at who's calling 211 in terms of the volume and the locations they're calling from and some of the demographic characteristics of callers when that was available. Then we're going to look at the greatest needs that callers expressed when they called, and that is when call specialists receive these calls at ViaLink, they classify needs according to a taxonomy system that most 211s use across the country. And then I'll turn it over to Tasha, and Tasha will talk about potential resource gaps and how we are, the extent to which existing resources seem able to meet those needs. So first, just in terms of total call volume, this is by year across the 10-year study period. And what you can see here is that there were highest levels of call volume for 211 needs in 2012. Of course, we had Hurricane Isaac that year. Then we had consistently for about 8 years decreasing volume of calls. In fact, a lot of indicators were showing that things were getting better over those years. Poverty was going down. It was just more stability. We didn't have any major natural disasters. And then 2020 hit. And you can see from 2019 to 2020, the call volume increased more than 250%. Obviously, that was the COVID-19 pandemic. We also had several natural disasters that year, particularly in the latter part of the year here in Southeast Louisiana. And then that increased further in 2021 with additional waves of the pandemic, as well as a huge spike, which I'll talk about a little more later, with Hurricane Ida. So things have really picked up in terms of the needs of our community in the last couple of years, as I'm sure you're all very aware and experiencing too. So now with this slide, we're looking at the average calls per month across the 10-year period. And it's pretty stable across most of the months, although you see a bit of an uptick in the summer and into hurricane season in the early fall. And the major call out here is September is by far the highest average number of calls, and that is the peak of hurricane season. That's when that's just after when Hurricane Isaac hit. That's just after Hurricane Ida struck in 2021. And so this really, the call volume over the course of the year really maps closely to hurricane season in our region. On this map, which Tasha created with her really fine mapping skills, what you can see is the different parishes in our 10 parish service region for ViaLink's 211 service. And the darker shades are higher call volume, and that call volume is adjusted for the average calls per 10,000 residents in poverty. And this is only for the last 2 years, 2020 to end of 2021. So the darker shades means that they're getting more volume of calls even when we're adjusting for the population living in households under the poverty line, the income threshold. And so what you can see is that Jefferson and Orleans Parish are generating, those residents are generating the highest volume of calls even after making those adjustments. In recent years, we've seen a big uptick in Jefferson Parish, as well as an uptick here you can see it in St. Charles and St. John the Baptist parishes. These were areas particularly impacted by Hurricane Ida. And you can see that some of the more outlying parishes in this region, Lafourche and Washington, received the lowest volume of calls. We'll have a lot more maps to share with you going forward. And looking at the demographics of callers, first we looked at age, and what we can see here is that the youngest callers, certainly below 18, minors, but as well as under the age of about 24, are very underrepresented in the region. On the flip side, the callers between about 40 and 60 are overrepresented. So the callers who are calling 211 and utilizing this resource that is freely available to everybody tend to be a little bit older, or let's say in the middle years of the age spectrum. In terms of ethnicity, 2/3 of callers over the 10-year period were African American, which for the region overall, that is overrepresenting African Americans in the region in terms of callers. We also found that the vast majority, almost 3/4 of callers are women, much more likely to call than men, people who identify as men. And we also found that 40% of callers self-identified as having a disability. And so that's also highly overrepresentative of people in the region with a disability. So we have a certain profile of who's most likely to call 211. So now looking at the needs, and again, this goes back to that need taxonomy. That's a way of classifying and categorizing different needs, and they're at different levels of detail. So we can kind of have the big picture of needs expressed, as well as zoom into more granular needs. So here's at the highest level, the most general categories of needs. And what we're seeing is that more than half of callers are expressing basic needs. And basic needs are for food assistance, housing and shelter, transportation, utilities assistance, just basic survival, the basic things we all need. And so that tracks pretty closely with 211's nationwide, where it's pretty consistent across 211 services that basic needs are the most expressed by callers. The second highest, just over 1/4 of callers over the 10 years, were expressing needs for referrals and information about government and community services. So this was more about connecting them to existing services. And then beyond that, you can see that it's pretty close between other types of needs. So now we're going to dive into the next level of specificity and break down some of those, especially those basic needs that were expressed. More than 1/4 of callers over the 10-year period expressed needs for housing and shelter, which was the highest ranked specific need, followed by utilities assistance, food assistance, and then those government referrals. And disaster services shows up. That's a wide, different variety of services, but specifically in a post-disaster context, that showed up for almost 10% of our callers. And going one level further to even more granular needs, here we have a ranking of the top specific needs that showed up over the 10 years. So at that level, the #1 most specific need that was expressed was for electricity payment assistance, followed by emergency food assistance, rental payments, again, government entities, and then transitional housing and shelter, and so on. So once again, the basic needs are very, very prevalent in our community. And so that's something to keep in mind in terms of targeting services and investing in what the community needs. So this is just for the year 2020, the trends by month in the number of calls that express certain needs. And a specific, one call can express obviously multiple needs, and so these can be double counted or triple counted. But what we saw here were waves of needs, generally following the waves of the pandemic, particularly in March and April, early spring of 2020. Of course, that's when the pandemic really started, and the shutdown orders and layoffs in high numbers were instituted by different businesses and so on. And then we had another spike over the summer, and then another spike towards the end of the year when we had some of the coronavirus variants, as well as some natural disasters, including more localized hurricanes in our area. So you can see these waves of the basic needs of housing and shelter, of food assistance, You can also see that the disaster service, which is the blue line, spiked towards the end of the year when we had some of those natural disasters. And this is just for the year 2021, the same type of graph, only now you can see that on the left, the number of calls is amplified quite a bit. So this is on a different scale than the previous graph. And the reason that is because in late August into September of 2021, needs spiked tremendously. There were more than 9,000 calls in that month alone, and you can see that it's primarily for disaster services. That's when Category 5 Hurricane Ida struck the region. There were widespread power outages. It was a serious threat to our community, and so that was a huge number, and that's where ViaLink really stepped in, as they always do, but in particular stepped in as a support service, one of the lead support services post-disaster. And although some of those needs have started to decrease towards the end of 2021, they did not go down to levels prior to that, which were actually starting to level out after the waves of the pandemic. And so those needs still continue even to this day, more than a year later. I'm now going to pass it over to Tasha. She did some really great mapping and analysis of the resource database and different potential resource gaps to try to connect the dots between the needs and whether existing resources and services are able to meet them. So Tasha.
Thank you, Dr. Mumford. So ViaLink 211 call specialists refer calls to specific organizations in their resource database, and they document if a need was met or unmet. And over the course of the 10 years, it wasn't consistently done, but it was done enough so that we could indicate a service gap. And of those 4 unmet needs, the most unmet needs were financial assistance, which was utilities or housing and shelter, like rental assistance, and food assistance, like pantries that we needed during the pandemic, and disaster services, during Hurricane Ida and Zeta. We also looked at resources that exist by parish and their exact locations in the region. And here you can see Jefferson and Orleans with the largest densely populated areas, where areas where people are most likely to access services in person, such as food assistance, housing, and mental health and substance use disorders. The data point here, this is mental health faculties against SVI, and the data points are geocoded addresses from each organization. And what they don't tell us is the capacity of the service. So we used social vulnerability index that was discussed earlier. And the darker shades are the most vulnerable populations. And what this also does, this can help us mitigate and prevent in an emergency, like where we might need to place shelters, where we might want to put supplies. And especially in these rural communities, social vulnerability, these are the most at-risk populations that we need to worry about during disasters. So this map, what we did was we wanted to look at proximity of where vulnerable populations are to a resource and kind of assessing the ease for them to reach a resource. And this is all of the food and housing resources combined. And we looked at the distance of socially vulnerable communities. And the dark again highlights the most vulnerable populations. And also in New Orleans, you can see there are a lot of resources, but we don't know the capacity. So that's probably a next step for us. But this is how we can assess proximity to a resource. I'm going to pass it over to Dr. Marker.
Thank you, Tasha. So what are our big takeaways from this analysis? One is that I think it goes without saying how critical 211 and how VIA-Link's services are to our region's human services infrastructure. And this is even more acute and more obvious in a post-disaster context. And we've had more than our share of them throughout the world, but certainly in Southeast Louisiana between the waves of pandemic, but then also, of course, we've also had natural disasters, including tornadoes, some major hurricanes, and just exacerbating existing inequities that have been longstanding. And so this is a really important service for us, connecting people to, especially to their basic needs. And that was a huge focus of callers' needs. The most basic necessities of housing and shelter, food assistance, utilities assistance, rent assistance, all these things that are necessary for survival. These are the connections that are being made between callers and existing resources to the extent that they can provide that to meet those needs. As far as the most common callers in different demographic characteristics, women were much more likely to call than those who identified as men in call reports. African Americans in our community were more likely to call 211 than other ethnicities. Those who are over 40 were more likely than younger people, and particularly people living with a disability were most likely to call 211. The most common unmet needs were related to basically the most common needs, period, because they were also the needs at the greatest volume, which was hardest to meet all those needs, including in financial assistance, shelter, and food assistance. And you can see how critical that would be, especially in a disaster context. We have some concerns, although there were limitations to our methodology. We have some particular concerns in terms of proximity to existing resources that need or are best delivered in person in socially vulnerable rural areas. Of course, we also have a lot of dense urban areas that may be undermet in terms of their needs, but it's harder to tease that out in our methodology because, like Tasha said, we don't have a metric of the capacity of different organizations to serve at high volume. But we see some opportunities potentially to do more rural outreach, both for VIA-Link and for different service providers, perhaps mobile units, and post-disaster, how to get services to people in more remote, rural, and vulnerable areas. And really, this is just scratching the surface of what this data can offer us. We are most interested in just giving you a sense of what can be done here, and hearing back from you all about what ideas do you have, what's the deeper dives, different analyses that might be useful, different questions you're asking for your services, and to direct and prioritize services and resources and promote investment in communities. We'd love to dig deeper. We'd love to help you dig deeper. I know Andrew and VIA-Link provide those types of services. So we'd really love, maybe drop in the chat, drop in the Q&A. What are some things that you'd like us to explore? What are questions you might have that 211 data or different call data can help answer, especially about community needs and our ability to meet them? So I'm going to pass it over to Andrew, who's going to talk about some recommendations that came out of this.
Great, thanks, Steve. So yeah, I'll jump in for the last part of this. This is talking about recommendations first for our partner agencies, folks like you who are on the line, and then we also had recommendations and learning that we had for VIA-Link internally. So, as Steve talked about and as Tasha talked about, and those maps showed so clearly that there are areas that are underserved, that have a lack of resources, that have a lack of resources within 10 or 15 miles of people. And those are most in the underserved rural areas like Plaquemines Parish, Washington Parish, Tangipahoa parishes. You know, you see the clustering of nonprofits and service providers in New Orleans and Jefferson Parish, and then a real lack of services. Like Plaquemines Parish, I believe, just has 3 food pantries for the entire parish, versus Orleans Parish has, I think, about 43. You know, and you also see that in terms of mental health facilities. There's just like, I think it's about 1 in Plaquemines Parish, and you see things like that in Washington and Tangipahoa as well. Hopefully every organization here is already in VioLink's resource database, but if not, Steve's going to drop a link in the chat that can show how people can join VioLink's resource database, and our team will work with them to make sure that their information stays up to date. You know, other ways of work that you guys can do is to promote 211 to your clients if you don't already. You know, I think everybody who works in the nonprofit sector at one point will create a resource database. You know, they'll start calling around trying to find resources and typing them out on a Word document and printing them out, which is great, but you know, that information isn't expansive and gets outdated. So what our team does can kind of save that effort and has a sort of comprehensive ongoing database. Steve's also going to drop in the page on our website. You can obviously call 211 to get connected with any human service resource you need, but we also have an interactive search portal on our website that we just launched a new improved version of a couple months ago that you can use to search our entire database. And you can, it's mobile friendly. You can text or email resources from it to people. You can translate it into a number of different languages. So it's a real good tool to make the community aware of. And then Steve, I think, also shared the link already to VioLink's dashboards. These are daily updated interactive data dashboards that you can use to explore our data more. You know, people have used it for things like grant writing, to give kind of background information about needs in our parishes, and you know, just goes deep dives into particular subjects. We're always updating them. As I said, hopefully in the next week or two, we're going to launch some social determinants of health dashboards that look at what our data can tell about social determinants of health around food, housing, and economic assistance for Southeast Louisiana. They're similarly going to combine our call data with the resource availability and census data to give a better sense of that. And I'll share my email address at the end of this presentation for folks, you know, who want to talk with me directly. We've had organizations that have requested to work specifically with us around specific types of data. Like we recently partnered with the Greater New Orleans Housing Alliance to look at what our data showed about housing needs in Orleans Parish. So we're always interested in partnering with organizations one-on-one. So this was a great process for VioLink as well. It allowed us to kind of reflect on our work, and Steve and his team made recommendations to us about sort of changes we could make and things we could focus on. One of those is the need to do more outreach to younger and rural residents. You know, as you can see, the call volume in places like Plaquemines Parish was lower, which I think is a combination of factors. Some I think is sort of a cultural thing of how likely people are to ask for assistance in different parishes. I think some of it has to do with the lack of resources in the parish, so that there's, you know, fewer food pantries to get recommended to, which would decrease call volume. Though, as Steve said, we've seen the call volume for those rural parishes jump in recent years, starting with COVID. And, you know, it looked at the need for us to expand partnerships with local government agencies, especially in those underserved parishes, to strengthen those relationships and increase call referrals to 211. And Steve and Tasha gave us good input about ways to have more consistency with the demographic information that we collect. You know, it's not always possible to collect demographic information VioLink through like the 988 system every week is handling calls from a live suicide situation. Obviously, in a situation like that, you're not going to ask the person about their, ethnicity. So it's not always in crisis situations realistic to talk with people about their demographics, but as much as possible to collect that information so we can provide that data. So now I see people are dropping questions in the chat, and Tammy, I'll let you sort of shout some of them out, or people can ask if they want to come off of mute to just ask questions. Things like, is there ways that you could use this data? Do you have specific questions about the findings? Is there ways that you could partner with 211? So Tammy, I'll let you ask questions, and folks feel free to ask to come off mute. Well, let's see. So we have a question from Beverly asking about the best ways to communicate the 211 exist and reach the largest audience. Yeah, it's, as I've said, Viewlink's been doing this work for over 100 years, and so it's been a sort of slow build to recognize these services. 211 has existed since 2001, so it's been about 20 years. They said it took about 30 years for 911 to become a sort of household, everyone knowing a kind of number. So I think that we're working towards that, and I think the number is more well known amongst lower income people who need that kind of help. But yeah, for agencies, I mean, referring to our website, we have cards that we give to folks that they can give out to clients. Those are some of the main ways that people use it, posting about it obviously on social media. We have a great outreach team that Tammy's on that is always available to be doing presentations. So if folks wanted us to do presentations, then that's another thing that we're happy to do.
Yeah, I think that's something we talked a lot about is how can this data inform outreach strategies, including target populations, let's say, who are least likely to access 211 and areas. And so what might that look like? And I think we are only beginning to really utilize and apply the findings from this analysis in terms of targeted outreach. And I think that's the takeaway is looking into these data. You can, as a 211 service for your region, you could identify who are we underserving and how can we make inroads into gaining awareness and trust with different communities, whether they be rural communities, different subsectors demographically, age groups, what have you, younger people. How do we get more traction with these different groups of people?
We had another comment from Alan Brickman talking about envisioning a diversity equity analysis, areas where a substantial demand from minority populations. Are there sufficient minority-led, culturally competent providers? Are there recommendations that are emerged from this analysis? Yeah, that's a great point, Alan. That's something that we don't track in our database of the leadership and what the makeup of the leadership of organizations are. So that would be a good way to kind of enrich this type of analysis.
Yeah, I agree. I think that's a great idea. The Viewlink, we've seen in the data has gotten better and better about consistently tracking demographic data from callers. It's not always feasible or appropriate to ask a caller some of that demographic information. And so, yeah, of course, we trust those call specialists to make that determination. But when it is tracked, it's very useful to understand how needs differ across different groups of people in the community. We did a little bit of that analysis. We didn't talk about it today for time reasons, but a little basic analysis of gender differences and racial differences in terms of greatest needs. For example, men express more needs for mental health and substance abuse treatment in the data. as well as white collars, which suggests that there may be some stigmatization or some different, different types of needs there, different types of culturally competent service delivery potentially. And so that's an area where we're just scratching the surface, but connecting it to who's leading these organizations. And I saw Devon Turner from the Greater New Orleans Foundation, a great partner of ours, was on this call. And we did a study, UNO did a study with the Greater New Orleans Foundation looking at that side of things as far as who's leading nonprofits, and maybe connecting those dots would be really fruitful in terms of exactly what Alan brought up. I think that's a really interesting direction to take this as the next step.
I see that Cassandra raised a question of how much do you think high levels of African-American women in middle ages being represented in call data is due to them being the outreach for other family members, such as aged parents, children, et cetera. Yeah, I think that's a very good point, Cassandra. Just as we do have some calls from people under 17 and even people under 10, but it's obviously a minority of callers, even though a lot of the services are going to them. So African-American women doing outreach with the family is a good point. Steve didn't get into it, but the report itself goes into some more specifics about how needs are different among ethnicities, and how things like the request for mental health assistance are higher amongst men and amongst white collars, where I believe African-American women, there was more frequently requests for housing assistance and things like that. So you can, if you look at the report, it dives into some more detail about that. Or you can use our data dashboards. They have filters on them where you can look at needs of specific populations. Like you can segment it down to disabled African-American seniors and see and sort of look at that information more granularly.
Yeah, that's a great point. And like I said in the chat, looking at these crosstabs, there's so many ways to kind of slice and dice and focus different analyses. Like I said, we only scratched the high level surface here, and would love to know what some more granular questions are. What do people want to know? What would be useful for different agencies and organizations to know that they can make actionable? And you also, Cassandra also brings up a great point that these quantitative data only tell us so much. They almost leaves as many questions as it is, because there's many different potential ways to interpret this, and also there's a lot of caveats and missing data necessarily so. And so so I think it's a starting point to inspire more investigation that may not be answerable with the 211 data by itself.
Crystal Bennett raises the question about in rural areas that it might be interesting to track how needs change over the course of the year, if there are specific needs that are higher during specific seasons. Yeah, that would be a great continued analysis. Crystal, good point. I think that could speak to the type of services that will that will need to be provided. Again, that's a type of analysis that you could do yourself by jumping onto our data dashboards and playing around with the date filters and the location filters. You could start to do some of that analysis yourself. But I think that as Steve and I look forward to the future, that could definitely be an area to look into more.
Alan had another comment and a question.
Great. Yeah, I see Alan raised tracking not just the number of providers, but the total capacity for services like slots, classes, the number of folks that they can serve. Yeah, that is a good point, Alan, that this doesn't show, the capacity of one food pantry over another, or one mental health provider over another. So that would be an additional layer to make this analysis more rich in the future.
Yeah, Andrew, that might be something to consider. I know you already collect a lot of information in your when you're tracking resources and updating the resource database. And I know that this could be something that changes pretty quickly depending on funding availability and program offerings and so on. But having a sense, especially in those more densely populated urban parts of the region, that, okay, just because something is close to somebody geographically doesn't mean that they can actually access those services. And there may be wait lists. One thing that we made use of, Tasha brought this up, in terms of the unmet needs. So that's a category that call specialists actually use when, and it's not necessarily perfectly reliable, as none of these data are, but if a caller is referred to a certain need or to a certain resource based on a need, and that resource is not available, it's not accepting people, they're waitlisted, if it's closed or there's just no resource there, then they would be classified as an unmet need. And so that gives us a little bit of sense of, although we don't know exactly why, there is some breakdowns of why the need was unmet. But I think, again, deeper dive, more reliable classification and coding of the calls will all help answer these really interesting questions that are being brought up.
Yeah, no, that is a good point, Steve, of looking at the unmet needs data and seeing specifically needs that couldn't be met due to lack of capacity. That could be one of the best options for tracking that information. And I see our Deanna Allen, who's our fantastic lead resource specialist, is talking about messaging me that we do have the ability to track those things like capacity. So that's something that we can start thinking about more.
I'm struck that how data-driven ViaLink is as an organization. And I know that's a fine line to walk because of privacy and confidentiality concerns, and wanting to keep the trust of people that they can call and they can express, they're in some of their toughest moments, they can express these needs and not be stigmatized or shamed for this, and feel that sense of privacy and credibility with ViaLink. And yet ViaLink is able to really derive so much insight and be a leader in our community in terms of use of the data and sharing of the data publicly to the extent that they can. And from my sense is that they really are also having a lot of leadership nationwide in terms of 211 providers, both on the data side and on the disaster response side. So I think I came away from this experience thinking how lucky we are in Southeast Louisiana to have an organization like this and have this resource. And we just need to tap into it even more and take advantage.
Yeah, thanks, Steve. And I think that, ViaLink sees our role as just not providing the services, but also being a source of this on the ground, live data that can assist in decision-making with all the folks on this call, like the staff in the Greater New Orleans Foundation or DCFS or nonprofit partners. I think that there's more of an interest in data-driven decision-making, and I think that this is one of the best sources, along with like census data, for helping organizations to make those kind of decisions. That's why we've put so much of a focus on getting data out there through things like dashboards in this community report. Yes, I see Cassandra, who's with DCFS, is talking about the No Wrong Door initiative that is working with, we've partnered with DCFS to provide more intensive care coordination to clients, and not just making referrals to them, but working with DCFS clients to provide kind of longer term case management to help them, or care coordination as we call it, to help connect them with resources and follow up to see were those resources able to provide the assistance that they need, did other needs come up, helping them troubleshoot, and just sort of long-term working with them, providing that care coordination to folks. So that's a direction that we see 211 and ViaLink's work going, is to that kind of longer term care coordination. And yeah, definitely appreciative to DCFS for that partnership we have with them to get started on the care coordination. And DOC, yes, thanks, Cassandra. That's another good point, that we're providing those care coordination services, not just to folks who are working with DCFS, but also through folks who are coming out of correctional facilities with the Department of Corrections, that we're providing that kind of longer term care coordination to folks throughout the state who are coming out of a correctional facility and providing them kind of longer term wraparound care coordination. So excited to be moving more into that direction. Okay, well, if there's no more questions, then we'll end and give you all back a few minutes of your lunch. But yeah, thanks everyone who joined us. Thank you so much, Steve and Tasha, for this great work, and thank you all for being the organizations that we're referring people to and you know, providing those services and providing the day-to-day work. It's all part of the same village. So thank you very much. We appreciate you all.
Thank you, everybody. Thanks for joining.